All right, let's get started. Next slide. So I want to share a little bit about how this presentation came to be. So Christine, I'm going to put you on the hot seat. Christine had a conversation with Sherry and I, and we were getting to know each other. She was sharing a bit about her office of public health. And we were talking about some of the conversations on the ground that we were hearing about wanting to better understand some of the Montgomery County structure. And so we began to brainstorm this idea and we parked it. And then the opportunity came where Sherry and I were talking with John Harris and said, hey, what about that idea? Can we get that off the ground? So Christine and I and some folks within our organization and within her organization put together the presentation for today to begin to have some introductions and better understandings about some of the county structures, in particular, starting with the Department of Health and Human Services. So I want to welcome all of our guests today and give them an opportunity to share a bit of an introduction about their different offices. This is a learning opportunity and an opportunity to ask questions. John Robertson will be monitoring the chat. If we could hold our questions, if possible, to the end, that would be great, and allow our presenters to share the information. Christine, do you want to kick us off? Thank you so much.
Yeah, so we can go to the next slide, please. So thanks everyone for welcoming us here today. We're excited to get to know some of our colleagues across the county a little bit more and just open up a conversation. If I could have the next slide, please. So essentially, we're just going to talk through a little bit where Health and Human Services resides within the broader county structure. Offer a little bit of a sort of background and overview of the Health and Human Services team as a whole, and then each of the folks here will give just a little bit of background about their respective program offices and a little bit about how you might find us or see us or how we might show up in the community. And then we just wanted to have some time for conversation. So my colleague, Kristen Fisher, is going to kick us off with that little bit of background about the county, where we reside within the county structure, and an overview of our office as a whole. So Kristen, would you be open to taking it from here?
Yes, I am. Thank you. You can move to the next slide. Thank you. So I'm going to be talking just briefly about the county structure. Since we are a large government entity, you can see here on the slide that it's kind of broken down into 3 divisions. We have the Court of Common Pleas, the Board of Commissioners, and then the row offices. So if I hit next slide, we'll show you an arrow where we are. Health and Human Services is down there at the bottom under the departments. So we are vast. I think we have over 3,000 employees. So this is kind of the basic structure of how we fall under basically the Board of Commissioners division there. Next slide. This is a picture of our main office for Norristown. This is the Human Service Center, which is on the corner of DeKalb and Fornance. So you can find most of our offices there, but we also have some satellite offices in Lansdale, Willow Grove, and Pottstown. Next slide. So we started or implemented our strategic plan back in the beginning of 2021. So this is a 5-year plan, and this is our foundational concepts, or the foundation of our strategic plan, which are mission, vision, and guiding principles. And I always it's easiest for us as Health and Human Services to remember that, our vision for Montgomery County is for residents to live healthy, safe, and connected lives, which you'll hear through the different offices that are present today in our presentation. A lot of times we have some organizations have values. We have guiding principles. So with us and what we're doing and what, how we're doing and what we're doing it, we want to make sure that everything we do is mindful of being trauma informed, maximizing diversity, equity, inclusion, and working in true partnership with staff, partners, and the individuals and families that it serves. Next slide. So with that, I like this image because the graphic gives you an idea of our guiding principles that are cutting across or going across or being implemented in all of our 3 strategic priorities, which you can see: access, prevention, and operate as one department. So we want to make sure that our community has access to the services they need, that we look at if we need to evaluate and increase our prevention services for the county. And then through all this, are we working as one department to consistently provide the services and resources that our community needs in Montgomery County? Next slide. Now, this is a kind of a deeper delve into the org chart of Department of Health and Human Services. So as you can see, we have the Board of Commissioners above us, but then we have a director. Right now we have an interim director, Penny Lafferty. And then we have 9 program offices on the left in that kind of turquoise color. And then we have 5 strategic offices that are on the right there that my office falls under. And just to give you a little bit about my office, as a strategic office, I help support and strengthen what is going on in those program offices with communication work such as website, social media, the collateral materials that need to be sent out to our community members to inform them of what we're doing. So that's kind of where the strategic offices there are to help with the program offices. Next slide, I'll show you the arrow of the different offices today that are with us. Community Connections, Public Health, you can see through that. So we have 2 strategic offices that will be presenting today, and then the other 5 will be from the program offices. And we could take all day and talk to you if we went through all 14 offices, but this is going to be a quick overview with the 7 that are here. Next slide. So I'm going to pass this over to Elizabeth DiArcangelo, who that will go into her program office in more detail, which is Community Connections. So we'll start with the next slide for her. Oh, one more, sorry. There we go, Community Connections for her. Go ahead, Elizabeth, your turn.
Thank you, Kristen.
Sure, you're welcome.
So I apologize, I'm going to try to go pretty quickly through this. I'm not going to read everything. Obviously, folks can do that on their own, and I'm sure we'll share this out. But I oversee the Office of Community Connections. Like Kristen said, we are one of the 9 program offices for the county. Our staff are called Navigates. So you may have heard us referred to as the Navigates or the Navigate program. Go talk to a Navigate, see what resources Navigates have. But officially, we're the Office of Community Connections. Our mission is to provide compassionate assistance by our highly skilled staff, and they're Navigates because they navigate and advocate for those in need of human services. We foster partnerships in the community with our providers, and we work to improve access to services for all the residents of the county. So there you'll see the roles: fostering, linking, advocating, and connecting, as well as at the very bottom, you see this person-centered counseling service. That is essentially a service that we provide if someone is a senior and that's 60 or older, or they identify as having a disability. That's something that they self-identify with, not something that's necessarily diagnosed by a medical practitioner. The work that they do in that is very similar to what an advocate does. So when an individual or family or maybe a provider is calling on behalf of someone they're working with, or if it's themselves, and they're not really sure, where to turn for, whatever's happening for them or their family. Could be housing issues, could be employment issues, could be mental health issues, medical issues, whatever falls under the umbrella of human services. We can help direct them to either services that are provided by our other 8 program offices or some of the contracted providers they oversee, or the various partners in the community. Creative Health out in your area, the local family and parent centers you all are probably aware of. But the role of an advocate is really to understand what the person is calling about, and to connect them to resources that may match their needs. So whether that's their location or their age or maybe by insurance, their job is to kind of figure out what's going on for the person, what that person may be looking for, as well as to think about what other services may help them that they haven't even considered in what's going on with their situation. One of the things that we like to say is that we do advocate for people. You know, someone may be trying to connect in the community, and for whatever reason, it's just not, that fit is not happening. So when we do person-centered counseling, for example, there's going to be some back and forth with the individual, or maybe the providers that we may be referring people to make sure that there's connection that's happening, eliminating barriers, or trying to find other resources because maybe the person's not eligible for a resource we offered them. So person-centered counseling is a little bit more intensive than regular Navigate service. Sometimes it lasts for up to a month, maybe 2 months. It depends on the person's need. And we do provide follow-up with person-centered counseling, whereas if someone calls an advocate, it might be a 1 or 2 time interaction. And then if there's any difficulty with the resources we provided, that person may be calling back on their own. But whereas with person-centered counseling, the advocate is responsible for doing that follow-up. Next slide, please. So we do serve anyone in Montgomery County. There's no cost for our services. We don't ask for insurance or anything of that nature. We do get calls from parents and loved ones, or I'm sorry, family or loved ones from outside of the county or even outside of the state, calling on behalf of someone who lives in Montgomery County, and maybe that person they're calling about or concerned about isn't reaching out on their own. So they're trying to do some research on their own to provide services. So sometimes we do get calls from right next door in our neighboring counties. If the advocate in that region is familiar with a resource, then they'll make the referral. They're not going to turn someone away. But if it is a very nuanced need that the person may have, they may refer to something like 211 who serves the other bordering counties for us. I mentioned advocacy already. We will reach out to providers and our partners in the community if someone calls us and says they have trouble connecting. We don't pull strings, we bypass anything. You know, organizations have their priorities and, you know, their wait lists, and we don't bypass any of that. We just try to figure out what's going on for the person, why that resource wasn't successful, and maybe to help them understand that they might not be eligible, or there's a waiting list, or, you know, there might be something else that they're eligible for. We do get a lot of calls for people, you know, struggling financially. They're looking for, you know, financial assistance, and a lot of times that's just not really available. So we try to figure out other ways to reduce expenses, enroll them in programs that might help offset some costs for them. But most of the time, there's really not too much financial assistance available for folks, unfortunately, you know, especially considering the times that we've all been living through these last 2 years. And I think Kristen mentioned it already, but yes, we are available in 4 of our county offices. Norristown is our home, Lansdale, Pottstown, and Willow Grove. We do have advocates. We've been in person since May. So we are available for walk-ins, but we do hear from the community mostly by phone now. And with that, I will turn it over to our colleagues in the Early Learning Resource Center, Jeanine and Teresa.
Good afternoon, everyone. The Early Learning Resource Center in Montgomery County is for Region 17 in Pennsylvania. There are 19 Early Learning Resource Centers in the state of Pennsylvania. And Early Learning Resource Centers provide a single point of contact for Montgomery County families, early learning service providers, which are typically child care centers or child care programs, and community members looking to gain information and access services that help support high quality child care and early learning programs in our county. Our services are free to anyone that's a resident of Montgomery County, and they do not have to qualify for any of our programs to receive assistance from our office. The ELRC is funded by a grant from the Pennsylvania Department of Human Services through the Office of Child Development and Early Learning, also known as OCDO. And our program is state branded through the governor's office. We also administer a program called the Child Care Works Program, which is a subsidized child care program. And we have 4 funding sources that we offer through the Child Care Works program. We have low income, TANF, SNAP, and former TANF funding. We also administer the Keystone Stars program, which is a quality improvement program for childcare providers in Montgomery County. We have a resource and referral unit in our office, which offers resources for families, including, among other things, coats, diapers, books, health and beauty aids, toys, and many other items. And we do have collaborations with other community partners that we can get other items for families if they are in need and we're able to obtain them. We offer personalized childcare referrals based on a family's specific needs or preferences. Next slide, please. We have in our office community engagement programs that we administer. We have the Local Leadership Council, and we have the Health and Safety Regional Task Force. The Local Leadership Council is one way that we utilize resources to work within the community in an integrated and collaborative way. We have members on the Local Leadership Council that are childcare providers, families, school districts, higher education programs, businesses, and other funders also contribute as part of the Local Leadership Council. For the Health and Safety Regional Task Force, we have a lot of partners that we work with through the task force, including the Montgomery County Office of Public Health. And topics that we discuss we try to make them relevant to the early learning providers in the community and within our county. The Health and Safety Task Force is also comprised of our Early Learning Resource Center quality coaches who work with the programs, the childcare programs, to improve the quality of the programs. We have program quality assessors, preschool program specialists, early intervention consultants, certification representatives from the DHS Bureau of Certification, and infant and early childhood mental health consultants. The task force is informed by an assessment of the needs of the childcare providers in the region, and we work together cooperatively to help meet those needs. And then the purpose of the Health and Safety Regional Task Force is to put the health and safety needs at the forefront of the early childhood education programs. Next slide, please. Also, under the Early Learning Resource Center is the Montgomery County Court Care Child Care Program, which is a DHS licensed drop-in child care center. The program is available for any residents of Montgomery County, and it offers short-term child care for families who have court-related business or other county business. The court care program is offered at no cost to the families who need the service, and reservations are recommended but not required. Court care program also offers a variety of age-appropriate activities to meet every child's needs, and the services are provided in a secure, safe, and sanitary environment. The program is for children 6 weeks through 12 years of age, and the program is open Monday through Friday from 8 a.m. to 4:30 p.m. And I would like to turn it over now to Kayleigh Silver, the administrator for the Office of Housing and Community Development.
Thank you, Jeanine. Again, I'm Kayleigh Silver, the administrator for Montgomery County's Office of Housing and Community Development. Our office as a whole's mission is to provide a comprehensive coordinated program that addresses housing, community, and economic development within Montgomery County. It's important to note that my office doesn't provide any direct public-facing services, like just directly out of this office by staff personnel. Instead, our role is much more to sort of administer, coordinate, and oversee programs and funding delivered out to the community. But one of the things we do oversee and help administer is Your Way Home, but Your Way Home isn't just this office, it's a broader public-private partnership. And our mission was recently expanded to ensure that everyone who lives, works, learns, and invests in Montgomery County, Pennsylvania has equal opportunity to live in an affordable home and a thriving community. Next slide, please. So how our office helps a little bit, and I apologize, it seems some of this got cut off, or I'm not sure if that's just my Zoom screen. I just briefly mentioned Your Way Home. When Your Way Home launched in 2014, we are the homeless crisis response system, particularly to help people experiencing homelessness if they're sleeping in a place not meant for habitation or in an emergency shelter or needing an emergency shelter in Montgomery County. And so our coordinated entry or access point to Your Way Home is dialing 211 or texting your zip code to 898-211. So again, out of our office, we sort of oversee the operations of the Your Way Home continuum of services, which do include, again, this front door 211, our various street outreach teams assisting people experiencing homelessness, various emergency shelters throughout Montgomery County, both for families and single adults. And then we have a large swath of rapid rehousing programs delivered out of housing resource centers via various nonprofits in the community in order to help exit people out of homelessness and back into housing, rental housing of their own via case management and short to medium term rental subsidies, and then connections to jobs, income, employment, etc. We have expanded Your Way Home by offering a few homelessness prevention services, particularly the Eviction Prevention and Intervention Coalition, or EPIC program, which provides on-site services in eviction courts that see the highest cases of evictions throughout Montgomery County, to offer emergency financial assistance and access to legal representation on the day of their eviction hearing. We are also Your Way Home is also helping to oversee the Emergency Rent and Utility Coalition Program, or ERIC, which is new. And this came out of, out of national funding from the U.S. Department of Treasury to offer emergency rent and utility assistance to those who have been financially impacted by COVID-19 and are in need of emergency rent or utilities. So again, the front door to these services can be accessed by dialing 211 or contacting one of our Your Way Home partners directly. And we also recently launched a new initiative entitled Homes for All, which is helping us expand advocacy efforts and initiatives into addressing housing affordability across the county, while Montgomery County continues to be and grows to be a very desirable place to live. It's working with our local communities to be really intentional around providing housing opportunities and housing affordability for everyone. Out of our office, we also work very closely with the Housing Equality Center, and we are tasked out of this office by our federal oversight of the Housing and Urban Development Department, or HUD, to affirmatively further fair housing. And we partner really closely with the nonprofit Housing Equality Center of Pennsylvania and help people who may have experienced housing discrimination. And then again, partnering to help HUD's mission to affirmatively further fair housing and fight housing discrimination across the county. We do run out of this office directly a first-time home buyers program for income qualified Montgomery County residents who are looking to buy their first home. This program helps offer down payment assistance for qualified applicants, and applications are accepted on a rolling basis. We also, out of this office, do run a homeowner repair program. I will warn transparently that this program is not on a rolling basis, and unfortunately has a very long wait list for homeowner repairs, but that is another program that we do run out of this office. And then, as I stated, very few programs or services are run directly out of this office. A large portion of what we do are offer various funding opportunities at the federal, state, and local level for housing rehabilitation, construction of new affordable rental housing, housing and homeless case management services, and others. So we do have a funding opportunities page, and our yearly funding application cycle is currently open. And with that, I'm going to hand it over to LeeAnn Moyer to talk about managed care solutions.
Hi, everyone. So Managed Care Solutions is one of the strategic offices within our structure of the Department of Health and Human Services. And we work in collaboration with the Office of Mental Health and Drug and Alcohol for the overall responsibility to plan for and fund, monitor of the public behavioral health system of care. We're a multifaceted team. We're responsible for the Behavioral Health Choices Program, which is a state managed Medicaid program here in Pennsylvania. So our contract is directly with the state for the Behavioral Health Choices program. Our partner to assist in that management, we have a contract currently with Magellan Behavioral Health, and they provide the overall management and of the delivery of the behavioral health services. So they're the ones who actually contract with the provider community that provide those services. Some of our goals include to improve quality and access to care, braid funds to optimize our resources, whole person trauma-informed approach to care, connecting care to social determinants of health, create performance and value-based purchase agreements with the providers. Next slide. Next slide, please. Yep, there it is. I broke our functions out into three main areas. Behavioral health program, the actual behavioral health system component. Responsibility is the oversight of in-plan and supplemental services. So in-plan, I'm sure you've heard the term essential benefits when talking about healthcare, whether it's your own personal coverage or it's often referred to that as essential services or benefits within the plan across media and other avenues. In-plan basically is the same thing as essential benefits. It's what the state has defined as in-plan. Over the years, and this program was implemented, it's our anniversary month of February 1997. So it's the 25th anniversary of this program. And the in-plan basically has not changed through the years. But what has been the creative aspect of the program is the supplemental services. And supplemental services are designed and created to benefit the members on specific needs, as well as create savings in in-plan services. So within that, we plan and develop and implement new initiatives, such as the Community Health Choices program, which was implemented a few years back for senior and disabled individuals, integrated whole person care, linking the social determinants of health with care management. And we have a couple pilots out there right now for that, increasing evidence-based practice and value-based purchasing with providers. The financial management that our office assumes is an at-risk contract with the state. So the at-risk component, typically when the state contracts with the counties for different funding streams, they're given a set amount of money and they fund as many individuals as they can or programs within that amount of money. And when it's done, it's done. So that's why you'll hear, in, for example, in the drug and alcohol world, they're given some treatment money to assist with individuals who are not on medical assistance. But when that money runs out, the service runs out. In an at-risk contract, we're at risk to serve everyone in need. So if we run out of money, we tap into certain securities or risk funds that we've been able to save over the years. So the program really is an entitlement program where everyone who is on medical assistance is entitled to these services. So since the beginning of the program, which I just mentioned was 1997, we have been consistently containing the costs and generating savings. Savings with the county go into what is called reinvestment plans. And those plans have to be approved locally by our county's board, as well as the state has to approve the use. And the state's guidelines say those reinvestment funds must be reinvested into the communities. So we have opened housing programs. We've started up evidence-based practices. And the list is pretty long. As you'll see, I've noted there that we've generated over the 25 years more than $50 million, and that money has been reinvested in the community. Quality performance, there's a quality management plan. It's our responsibility to plan and develop and implement and monitor performance measures. Assess consumer satisfaction is a key component of our quality plan. Quality standards and measurements have yielded continual improvement of our services, and access to care has increased steadily over the life of the program until COVID hit. I will say we were hit pretty hard with COVID and are still dealing with some serious challenges related to that. And with that, I will turn it over to Pam Howard.
Hello, everyone. So again, I'm Pam Howard. I'm the administrator for mental health, developmental disabilities, and early intervention. I've never kept myself so tight to 2 slides. I think I probably could have put more info on here, but our offices are so different in my office that I think I would have just taken over the whole slideshow. So with that, I'll just ask you to flip to the next slide. And, I'm going to talk about each of the 3 offices separately. So for mental health, as LeeAnn indicated, our work really has to do with kind of setting up a public mental health system. And we really do that. LeeAnn and I sometimes feel like I think Siamese twins, we're connected to each other, or co-joined twins, I'm sorry. And so we're connected to each other a lot because the planning for this system, really the funding comes in into her office and into our office. And one of, I think, the strengths of Montgomery County is that we really look to, LeeAnn had it in one of her slides, talk about braiding funding so that we can create programs that it doesn't matter the funding streams, that people can be served by the same program, regardless of whether they receive funding from mental health or funding through their health choices benefit. So a lot of the supports and services that we contract for are through, many of them are through the community behavioral health centers. I know Christine's here from Creative Health, and that is one of our community behavioral health centers, but we contract with community behavioral health centers throughout the county. There's, let me try to see if I can do this. There's 6 different providers and 7 different centers out in the Abington area. There's one for children and youth, and then one for adults. And what we do is we work to assure that there is funding there for individuals who are uninsured as a way to provide some safety net. Now, the funding is limited, and it's limited by what comes into the county from our state allocations. But what we do there too is we provide case management services that help people to acquire whatever benefits that they're eligible for. We also contract a lot for, what I look at as kind of like the rest of what supports the whole person. Some of the rehabilitative supports, and a big portion of the mental health budget goes into housing and residential programming. I think it's about 60% of the mental health dollars that come into the county go toward that. But we also provide services such as case management and student assistance. Again, we contract out with providers. We're an administrative office. So, we do the planning and coordination and contract out with providers to provide the actual services. Our office also has oversight of the emergency crisis and commitment functions. We have oversight, and we contract out for this. For the delegate services at MCES around emergency commitments. And, we have oversight of the court coordination for that function as well. Some of the priorities for the adult mental health system currently are around assuring that treatment and access to treatment, as LeeAnn said, the COVID pandemic has just really, that has been challenging in terms of access, but we're continuing to work with providers to, continue to improve access. Also around housing and residential supports, employment and education, and peer support. One of the biggest components of a system that promotes recovery is to have a lot of peer support available to individuals. And I do think that that's a sort of a point of pride for Montgomery County, is that we really have had a big focus on peer support throughout our county. And then we provide children's services as well. Most of the children's services are funded through the Health Choices program, but we do provide funding for student assistance programming in the schools. And we do that. It's a great partnership with our Office of Drug and Alcohol to work with providers to provide those services for prevention and student assistance in all of our school districts across Montgomery County. And then, we do like some initiative work too. So there's a lot of work that goes into decreasing the numbers of people who are connected to the criminal justice system. We work closely with behavioral health court. We have a suicide prevention task force. And one of our big priorities is continuing to advocate for mental health dollars because we have not had a lot of cost of living increases to the mental health budget. Since 2008 was the last cost of living increase across the state. So that's mental health. Then for developmental disabilities, we are known as the administrative entity for the state services. So in essence, what we do is we do verify the eligibility for services for the state office. And then people are connected most times to waiver services if they're eligible for them. And then our office works to qualify providers to make sure that providers have the correct qualifications to provide services. And then we monitor those services. We do a lot of community education and outreach. And then individuals who are receiving services they're referred to a supports coordination office. And with those supports coordination offices, they develop plans for the services that the individual receive. And part of our job as the administrative entity is to review and authorize those plans for individuals with developmental disabilities. So we are we use the term developmental disabilities because that eligibility for services includes both people who have a diagnosis of an intellectual disability, and that would be prior to age 22. They have a full-scale IQ of 70 or below and some significant limitations in some of their areas of functioning. But then it does include now the work that we're doing to verify eligibility through services are for individuals with an autism diagnosis as well. And that diagnosis similarly would have to be before the age of 22. They would have significant limitations in some of their functioning areas. And there would need to be some recommendations from a physician as well. So those are our developmental disability services. They're provided again through the waivers that come down through the state, which are based on a person's level of need. And there's different types of waivers that somebody would be eligible for based on their level, the level of need that they were verified for. Then we have another office, and that's our early intervention offices. And this is the office that provides intake and then connections to services through for our littlest guys, children age 0 to 3 who are experiencing developmental delays. So this office is our only, I think Kayleigh was calling it public facing office in terms of service delivery, because we do out of our office provide service coordination. So a family who was concerned about their child would call upon our office and then would be scheduled for an evaluation to determine whether they would come into the system, whether the delays were significant enough for a child to come in. And then once their eligibility was verified, we would get a connection to service coordination after that evaluation. And then the service coordinators would work closely with the family members for a development of a plan and to bring in the supports and services to work with the family. And it's really meant to be a sort of a coaching and supportive model that collaborates very closely with the family during that, because we're with that child for a very short time, if you kind of think about that period from age 0 to 3. So that's a lot of information really quickly, and I'm always happy to come back and sort of blow out that conversation for those supports and services. And with that, I think I'm handing it back to Christina.
Yes, you are. Hi, everyone. So if you might go to the next slide, please. So the work of the Office of Public Health, the work of public health more broadly, is to promote and protect the health and well-being of the entire population. We have multiple teams across the Office of Public Health. I won't go into detail about each of them, but there are so many ways that we show up in the community. Before the pandemic, folks probably thought about Office of Public Health as the folks that came out to do restaurant inspections. Since the pandemic, probably more along the line of thinking of us as the folks that do contact tracing or offer COVID vaccinations or do COVID testing. If you wouldn't mind going to the next slide. Actually, let's go to. I'd like to introduce Dave Genova, who's part of the Office of Public Health and the Office of Community Information and Education, to talk about one of the other ways that we show up in the community, and that's around health promotion. And Dave, if you want to give just a 1-minute overview of health promotion's priorities and work, we might have just a minute or two for some questions too.
Yeah, I'll try to talk quickly. So the Health Promotion Division is managed and administered by the Office of Community Information and Education. Sorry, I'm fighting through a cold. So we're a team of 9 staff with various backgrounds and education levels. We have myself as the director, a field supervisor, program manager, a registered dietitian, and then 5 community health educators. It's our job to empower people in the community to live healthier and safer lives. And we do this through providing health education, community outreach, creating social media campaigns, changing systems and changing the environments with a real emphasis on access to healthy foods, access to safe physical activity and injury prevention. We focus on collaborating with individuals, families, organizations, and communities to play active roles in achieving and protecting and sustaining their health. And we do this, but especially in pockets of the county where there are clear health disparities and health inequities. The type of programming that we offer are community programs, partnership programs, and community traffic safety programs. So our community programs are considered direct services, where mostly any Montgomery County resident can call and receive these services. So these programs would include CPR and AED trainings, CDC diabetes prevention program, car seat passenger safety, including virtual car seat checks, the Montgomery County Trail Challenge, which you may have heard of, suicide prevention training through QPR training, and then community gardens, which Norristown has a priority over. Our partnership programs are considered more indirect services. We provide these services to our community partners. An example of one of our partnerships would be collaborating with the Abington Lansdale Children's Health Clinic for a fruit and vegetable prescription program. We tend to stay with our partnership programs for a minimum of 1 fiscal year. We also offer PennDOT Community Traffic Safety Grant programs, which focuses on 11 different focus areas, everything from distracted driving to impaired driving to teen driving and pedestrian safety. We do have a community traffic safety coordinator that oversees this grant. She coordinates education opportunities at schools, work sites, and community groups. If you want to learn more about our division and about our office, you can visit www.montcopa.org/community health. I think we have 1 minute.
This is the tough thing when you have so many offices in a short period of time.
All right, are we at the point for questions? I think we are. I think there are a few in the chat, John.
Yeah, there are a few in the chat. I'm going to work backwards a little bit. When will clarification around services for autism only diagnosis clients be provided? Hearing that there may be some need for more information about this new waiver eligibility.
I am not sure. So there is the autism waiver, and what we do is we there are people who can qualify for the developmental disabilities waiver with an autism diagnosis, and we're also verifying eligibility for the autism waiver. So I'm not sure if that just made my answer more confusing. So, which is probably the problem. So that there's not a new waiver. It's just how people are sort of entered into or found to be eligible for the existing waivers. Does that make sense?
So do all of those clients, whether you are autism only or IDD, receive the same benefits, or are they given different benefits based on their classification?
See, I think what happened is that the autism waiver was so small. You know what I mean? There weren't a lot of waivers, so there was space created for people to be eligible. Many of the people who sort of moved into the system at first were people who had who also had a secondary, an ID diagnosis as well. So people can qualify with simply an autism diagnosis for these other developmental waivers as well.
Okay.
I hope that
guess
makes sense.
I would just say that within the community, I think just based on our conversation right now, there's need for clarification.
Mm-hmm.
So I guess I would just provide that feedback.
That's great. That's great to know. And then I'll take that back to our DD staff, and so that we can try to work to get more clear information out there.
Okay, John?
Yeah, we have time for one more. I know this came up a couple of times, specifically barriers to mental health access during the pandemic. And one of the questions in chat was what specific actions are being taken to improve access to mental health services?
Well, one of the things that we've done is we've done a lot of work, and I'm saying we, and I'm going to be speaking for LeeAnn a little bit too. I think she had to jump off, and I have to jump off in a sec too. We're going to the same meeting. Is that we've really worked hard with providers to create some payment mechanisms that would help them to retain staff throughout the pandemic. And so that was one of the one of the biggest things that we put into place. The other is that we've been really working to try to help. We're doing some work currently to try to have some creative strategies that could go into place in terms of support while somebody is waiting for services. And lastly is that, we've really we have always worked to try to have a strong crisis response, mobile crisis system, peer talk lines, promote access to our mobile crisis, so that could help to fill some gaps until people can get connected to supports and services. So like all, industries, I think pretty much everywhere, is that a lot of this has to do with staff and staffing shortages. And we've been really working to try with providers directly to try to figure out some creative solutions and bonus payments and, sort of COVID payments, hazard pay throughout the pandemic to try to keep the providers strong and functioning throughout all of this.
Great, thank you.
So I think we come to our end point. We're a few minutes over for our guests, and I want to thank Christina Miller and her team for their time today. This has been an incredible presentation, and I want to especially welcome all this information is very welcome. And I think that this is a bridge to better understanding about some of the complexities of the county. And this presentation will live on. I think that many of you provided your direct contact information in the chat, which is great. I see that there's some funding opportunities, so that would be great for our community to learn more about. Christina, I can't say enough about the appreciation we have for putting this all together and working with your team and the time that you spent to bring this information to our community today.
Well, thank you so much for the invitation. It was really fantastic to be able to join all of you today. Thank you for inviting us into your space for a little while. And I hope that this is the start of several conversations among colleagues and partners. So thank you very much to everyone, and we'll let you get on with your meeting.
Beautiful. Thank you.
Thanks so much.
Thanks,
Have a
everyone.
great rest of the day.